My hand, welcome.
Well, thank you. I think we are following, that was an incredibly powerful presentation and story, and very moving. I think what we're going to share is the story of our journey and where we are in that journey working with Virginia Mason. And it's a transformation journey. And I think the most powerful part of it for me, it's really about really truly becoming patient-centered, not just clinician-centered, provider-centered. We think about ourselves all the time, how do we do things, but really truly becoming patient-centered. And then it's also about capturing the hearts and minds of all of our staff who all want to do the right thing, but we get caught up in everyday tasks all the time. And so it's a lot more than just tools. A lot of it is around culture. So we'll take care of some of the business parts.
Yep, neither Dr. Ramirez nor myself have any disclosures. Okay, next slide. And then our objectives, we're just going to evaluate and identify key factors that will influence the selection of a management system. We're going to explore how organizational structure or organizational culture influences the adoption, implementation, and so forth. And then examine how we can overcome challenges and kind of rocks in our shoes. And we'll talk more about rocks in our shoes in a little bit. All right, who we are. So Foundation Health Partners, we actually have kind of three parts to our organization. So we have Fairbanks Memorial Hospital in Fairbanks. We have Denali Center, which is our long-term care facility. And then also Tanana Valley Clinic, which at one point, I don't know if it is anymore, used to be the largest provider clinic in the state. I'm not sure if that's still the case or not, but.
We don't call it that anymore. Yeah, the largest doesn't always mean best, and that's what we're aiming for. So we are also this unique, I don't want to say totally unique, but every place in Alaska is unique, right? And so what's unique about Fairbanks is that we're in a fairly mid-sized to large community for Alaska, almost not 95,000 roughly in our immediate service area. But we end up being a hospital system with a lot larger than critical access, but a lot smaller than what you would usually see in an urban setting. And so we find ourselves often with being too big to be small and too small to be big. And so how do we staff? How do we provide services? How do we maintain what we need to do to take care of patients safely? We don't have a tertiary hospital. So we're not a typical community hospital. We don't have a tertiary hospital an hour or two away. So those are just some of the facts. We're the largest Medicare provider in the community, which creates its own challenges. We have a unique relationship with the military hospital in our community. We are the backup for that military facility because they are so far from J. Bear and Anchorage, which we've had all the folks out from DC to talk to us, sharing earlier today, because it is a very unique relationship that they don't see anywhere else in the States. So just like every other facility in Alaska, we have some of our uniqueness. And this is also us. We're really good at putting out fires. And if you've seen this, this is like from a 5 stages of Aldrich's journey, putting out the fires, and then you get better and you get more fire hoses everywhere. So we're pretty good at that too. We build new buildings, we get the equipment, we try to find the people. But the last phase we have struggled with, I've used this slide multiple times and we've been stuck on this phase for a number of years. And this is where we're being really proactive and evaluating what we need to do and moving forward in a systematic fashion. This also is us. Good news is we have a 5-year vision. It's based off of our 4 pillars. The 5-year vision is we want to become an integrated healthcare system. So Jen talked about the 3 different parts. want that to be one system for our patients. They expect it of us, they need it from us. But we really didn't have a pathway to achieve it. And so it ends up being goals, and everybody just has to work harder. And this is my favorite slide that I have shared for years. We're busy. We're busy all the time. And so oftentimes we end up in a situation, and this is a slide of we don't want to be this. We end up in a situation where we're too busy to take the time out to learn new things. So that's who we are. Or, oh, one more slide on who we were. Docs. I'm a physician. I was the first chief medical officer that was over both the largest multi-specialty clinic in the state and the hospital. And what I experienced was it was two different medical groups, and ping pong is the way I felt going between the two. And when I would go to meetings, this is a compact with the physician leadership committee at the clinics. When I would go to meetings, they basically, myself and the CEO would go, and we would be told everything we were doing wrong. And so it got to be a meeting nobody wanted to go to, and you felt attacked all the time. So we had actually reached out to Jack Silverstein, who's done a lot of work in building alignment amongst physicians. That was before we started this Virginia Mason journey, and started working with him. And what triggered it was we had a resignation from one of our physicians that had been a long-standing person in the community who had actually come from Fairbanks. His father had been a physician. And when he chose to leave us, it was kind of, this isn't working. And Jack Silverstein came out and said, I need to do some fact finding. I need to see who you guys are. He came and showed up at one of our meetings and observed it. And afterwards, he was like, on my planet, then we need to do a retreat. And afterwards, he was like, hell no. I don't know what I sat through. That didn't make any sense whatsoever. What were you guys trying to accomplish? I was like, this is how we meet. And he said, you guys need to work together as a leadership group between the physician leaders and the administrative leaders before you ever try to roll something out to the frontline staff. On your tables, have 3 handouts, which I'm not going to go through, but we only have like 1 copy of each. And there's a deck of cards. You can look, you can flip through the deck of cards as I go through this. The deck of cards is an exercise called Truth Busters. And so we use that exercise, and this is the very, very first preliminary compact that we came up with. And it was just at the leadership level. And you can see how basic it was, that we kind of agree to share information and we agree to behave in a way that engenders trust, which was, but that's how basic we were having to start off at. And as he worked with us more, he kind of pointed out a little bit, how do you guys improve things? And we really couldn't articulate it well. And it's kind of a little bit of how we ended up with Virginia Mason. Jack Silverstein had done a lot of work with Virginia Mason. So 2023 is when we started with Virginia Mason. And the first part was they came out and did an assessment. And their assessment was comprehensive. We had to send materials to them. They came on site, they met with physicians, they met with administrators, they met with frontline leaders, they met with staff, they looked at patient satisfaction survey results, and then they came back with a full report, and this is just the kind of the basic results of the assessment. And, you know, it came back really good in that everybody cared. We had strong values, very much cared about patients, but they couldn't really see the evidence of it, except at Denali Center. They called that out as a bright spot in their report. So we got kudos for that, and we also got kudos for, or got called out, well, that everybody seemed to understand that there was an urgency for change. And that was really driven by a lot of the financial pressures after COVID, and we knew we had to do something different. And it seemed everywhere they went that everybody seemed to know that. But beyond that, you'll see that if you look out to the left, the colors that are a little bit more, that tells you like where you are. So this is like an assessment that will happen every year for us, but everything else was pretty much, you guys are working hard, business as usual is their nice way of saying that they really couldn't see evidence that even though we said we were patient-centered, we wanted to be the best, et cetera, they couldn't really see that we had systems in place that could actually deliver that on a consistent basis.
So what we learned as part of that assessment, and I think as we move forward throughout this journey, these items we are seeing time and time and time again, silos throughout our organization. Oh my gosh, they're everywhere. And getting people to even recognize that they're there is challenging. Large amount of variation. We do not have standardized work. What's done on the surgical unit is different than what's done on the medical unit. And even just basic processes are completely different amongst those units. Sustainability, you know, as Dr. Ramirez mentioned, we are very, very good at when it's crisis mode and getting stuff done, but then sustaining it, not so much. Next slide. So in the past, this is kind of what we've done. We kind of try new things and everybody is all in. Everybody, all leaders, all staff, everybody is ready to jump in. But then there's no one there to kind of catch them when they start to fail or start to not be able to swim well. As we kind of rolled out this work with Virginia Mason, probably one of our biggest challenges was people really feeling like it's the flavor of the month because we've tried so many different things over time. So the challenge really became, how do we make people understand that this is our roadmap and this is the way we're moving to continue that kind of over time. So what we really learned is Virginia Mason Institute, they helped slow us down. So it's not about being all in, it's about trying it different ways in different places kind of across the organization. So you're really kind of just dipping your toe in the water. We started out with a basic kind of trial contract with them. And so that was kind of our toe in the water. And what we kind of learned is it kind of starts to create ripples kind of throughout different areas. People start learning new things and start spreading ideas.
I would add that in these early days, the early phase, we wanted everything. So once people got a taste, they got all excited and they wanted everything to happen overnight. And we had to be continually reminded by our Virginia Mason consultants that we're in the like pre-inning of a 9-inning game and it doesn't work that way. And again, we need to start slow and learn it well.
And it just goes back to what we've always done, right? We're always all in it. And so really taking that step back to kind of have people just take little bite-sized chunks. One of the first kind of events that we did was advanced daily management. As I mentioned before, we had this superhero leadership style where, you know, a team would get something done and the leader is, you know, the champion. Really kind of drilling down and kind of advanced daily management helps us push that down to the frontline staff. And so really increasing how we display our data, what our units and our departments are doing, huddling around those boards, really looking at our challenges, our rocks and our shoes, and then kind of coming up as leaders with standard work, stuff that you should be doing every day. So this is some examples of some just real basic visual displays that we had in some executive rounding that we started as a result of that. One thing I really wanted to point out is we had one clinic. The day after we finished our advanced daily management, the leader went back and redid everything. We walked into her clinic and she had display boards all over the place and was really started working on getting her staff involved in that. So these are just some examples, simple. I mean, you can see construction paper, I mean, simple.
I would add, we had the opportunity to go to Seattle to see Virginia Mason and how they did it. And we had expected to see kind of a standardized approach, display boards, but they're all different in all their clinics. And what they really, and this was a hard thing for us, because a lot of our staff or our frontline leaders tell us what we want, you need us to put on there. And that's actually not the right answer. And it's really about teaching them to understand what their core business is, what they're trying to accomplish, and what's a way to make it visual so that all the staff know at all times how they're doing in whatever it is. And so it's longer and it's slower to have everyone come up with it. And it'd be a lot easier to just tell everybody what to do. And we, trust me, we wanted to do that several times, and we were stood down from doing that. I think over time, the other challenge is what you put up this year. As you get more skills, it evolves and it changes as staff develop more of these skills, so.
All right, so here's a quote from Muhammad Ali. I'll let you guys read it, but really when I'm looking at rocks in our shoes, you know, these are the little things that bug our staff. But you know what? They bug our staff day in, day out, day in, day out. They might be a tiny thing, but how can you as a leader really kind of identify those? So we've kind of implemented that as part of our daily huddles in our different areas. To really identify those, and as a leader, help remove the barriers so that the team can help fix those. And just the other day, it's kind of funny, I was out and about, of course it's break up, kind of up in Fairbanks, and I was walking around in my puddle boots and I got stones in my boots, right? And I'm walking and I'm like, oh my gosh, this totally makes sense. I'm like, I gotta get this thing out of there. And so really kind of identifying those to really kind of help the staff fix the problems, right? So yeah, we use the rocks in our shoes, and I think it works really, really well. We actually have one unit, they changed the name, they call it hay in their hair. So the leader of that area, she has donkeys that she raises, and so she changed it to hay in her hair. So we thought that was cute. She's got some really cute visual display that she uses with her teams.
And again, it's really about empowering the staff that those are things that we want to address, and sometimes they can address it, and sometimes the leader has to address it, but rather than just, it's the way it is, moving it forward.
And then leader standard work. So this was something that I think was a big aha moment, especially for some of our nursing leaders. Really looking at the work that you need to do every day. Is it rounding on your staff? Is it, you know, checking to make sure that, you know, an incoming email was addressed? You know, there's a big laundry list that you can put on this, and how much time does it take you? You know, as I built mine, I was surprised by how much time I really should be spending just in my unit and getting my stuff that need to get done every day. I think with the nursing units, what they were learning as they started developing this is some of the different leaders are doing the same things. And so how can we consolidate that, eliminate that extra waste? So we're only doing it one time. So I think this has kind of been a big, I think this one's a little hard for some of the leaders, and truly as we're moving into like our joint commission survey, like having leaders identify that, oh yeah, I should be touring my unit every day and looking for those environment of care things that we can fix or get fixed timely.
So there's like rules of thumb. So for an executive, it's only about 10% of your time is supposed to be on leader standard work. But for a frontline leader, it's more, maybe 40 to 50% of time should be standard work. And then, so again, working with the leaders to identify what that is for whatever it is that they do. So for me, I will just share that I learned there were certain things that when I thought about the things that I have to do every day, a lot of it was signatures and signing off on contracts and signing off on approvals for different things. So not a huge percentage of time, But in my head, those were always like the least important thing, because I was always dealing with like disruptive physicians or in times of COVID, it was COVID stuff and this and that. And so this stuff would always be like over here, and I would get to it when I had time, which was not today, not tomorrow, maybe the next day. In the meantime, someone else would be, where is that? And pinging me, and that happened. Three emails on it. So it actually, ironically, even though it wasn't like the most critically important thing for me, it was part of my leader-centered work, and just getting that into a list. I had like 7 items identified, and it's just prioritizing, getting that done every day actually made huge difference for the people around me and made huge difference for myself. So just magnify that a little bit, because then it starts simplifying and making sure that we're doing the things that we're committed to doing, instead of running around chickens with their heads cut off.
So as we kind of rounded with the teams who went through advanced daily management in the beginning, there were quite a few lessons learned. But I think the overall arching thing is culture. How do you change that culture, right? Letting people know it's okay to fail. It's okay to try something and it not work. You know what I mean? It's okay to go back in and adjust. It's okay to completely abandon it and try something else. The other piece that I think our leadership team struggled with is just letting go, because of kind of back to that superhero leadership, really letting your staff drive those changes. The areas that really have embraced this, I mentioned our clinic earlier, our internal medicine senior care clinic. You walk into that clinic now and everybody is involved in making changes. If they have an idea, they try it. It doesn't matter how small, how big, maybe somebody thinks it won't work, they try it anyway. So I think those lessons learned are huge. And I think the other thing is with, leadership, everybody learns differently, everybody sees it differently. And so the culture change is slow over time. The other workshops that we did were improving flow workshops. This was just an example of one thing that they've done in the workshops. We had physicians, RNs, MAs, clinic techs, and registration staff that would come to an improving flow workshop for the clinics. And it was a 2-day event, and they would break up into teams. So we'd have like a physician, a nurse, and a registration person, for example. And they would learn improvement methodologies throughout the day. They had, actual things that they tried. So this is a paper airplane exercise, just really looking at how you can remove waste from the system and whatnot. And they learned to work together, and at the end, they walked away with ideas that they went out as a team to go try on the different units. So these workshops have been very, very popular. At this point, we've had how many?
Oh, I don't remember now.
I think it's about 45 individuals that have gone through.
More than that. I would just say that I was looking at the picture. The paper airplanes have become legendary. We had a board member. We're paying money for doctors to sit in a room to learn how to make paper airplanes. But the key lesson from a doc perspective is, so I'm from a clinic doc. It seems to be more efficient. Going through the day, I'm seeing patients. They stack up the messages. They stack up the lab slips throughout the day. I sit down at the end of the day and I go through all of that. That's called batching. So now I've batched all that work. I do it at the end of the day. So the patients have already waited 12 hours at least. I leave it all for my MA the next day. Well, the MA comes in, she's got to keep me busy, and she's got her own tasks lined up. So she gets to it when she can, maybe towards the end of the day. And so now you have people waiting 2 days. Flow workshops are really about getting flow into clinics, where you're actually taking care of all the business as it comes up real time. And so it was changing people's mindset, because they all thought, I'm thinking of one physician, that batching was actually more efficient for me. But batching may have been more efficient for me as an individual, but it's not the most efficient way to get the work done as a team. And that is what the paper airplane exercise taught them.
Yeah, so it really kind of focused on that indirect care and that direct care. Because those of you who've worked with physicians know in an office, there's a lot of indirect care. And so how do we manage that?
So we're still in the phase of the jumpstart, early stage, put a toe in the water, some advanced daily management for 2 cohorts, a couple of flow workshops, and 2 rapid improvement events. The rapid improvement events are where we have a problem and we're gonna solve it. This outlines, I think, a couple of the time frame for the rapid improvement events, and a couple of things that are like really different from what we used to do. A lot more time and effort went into the planning and preparation, and it seemed like it was taking forever. I think everybody was very frustrated. But then the actual event, because they were waiting and waiting and waiting, but then the actual events involved the frontline staff who had been prepped, and the actual events were so energizing and so engaging for all the frontline staff who were a part of it, the process owners, and then there's a debrief at the end to all the executive leaders. Then at the end, everybody was like, oh my God, this is a wonderful process. But thinking back to the Jumpstart engagement, it seemed crazy that we were waiting 2 months to really begin to work on the problem. And then I think we have pictures of the 2 that we did as part of the Jumpstart was the CAUTI, which is CAUTI prevention. We've worked on CAUTI. This is a group that you guys all understand CAUTIs. We had worked on CAUTI since I'd been there, but we're in that too small, right? So you get one CAUTI and our numbers are thrown out. They're skewed forever. And you think you're doing better, but you're actually not really doing better because you don't know until you get that one a year. So it's been on the radar forever, but we made more progress during this event. And I think that was actually one of the feedbacks from one of our nurse leaders, was that we accomplished more in the past 2 days than what's taken, usually takes a year to get done here. In terms of simplifying procedures, simplifying protocols, proving things. I could go on, there's a whole story there. That was a sponsor. They called me during the event. And how do we get this approved? And I called all my superhero friends and nobody knew the answer, but they wanted to meet with me in 15 minutes. And so I made up an answer. I just said the CEO is going to approve it. So the CEO approved a protocol, clinical protocol, but we were not going to fail them. The other event, rapid improvement event we did during the Jumpstart was in the SPD area. We had a problem with contaminated instruments. We had a surgery that would get canceled from orthopedics probably once every 3 months. Now, if you look at it, as our SPD had looked at it, is the number of instruments sterilized, it's 0.00001, so that equaled 1 patient. Now, we never let it get to that patient, but canceling a patient in our environment is a big deal. People have taken time off from work, physician schedules are blocked, OR schedules are challenging, etc. And so every time it happened, different people would get emails, including our CEO or our techs and everything. When are we going to fix this? This event, we've not had one canceled since we had this event, which is over 1.5 years. The other thing I want to call your attention to, we also achieved in this particular event, we had a lot of discord between the 2 teams in SPD and OR, and because they worked together for 2 days, that's one of the biggest outcomes of improvement. And I asked the SPD head, how do you know? He said, well, my phone doesn't blow up anymore. It used to all day long, every day. The other thing call your attention to is the flow map. This is the nice flow map. The one for the CAUTI event was all clouds. So clouds are where a process has either variation or opportunity for improvement. And like I said, the CAUTI one was very disturbing, and Jen was directly involved in that because it was all clouds. This one only had a few clouds, which is back to our lack of standard work. And a big difference was that these flow charts were constructed by actually going out and doing direct observations and measuring times, as opposed to our old way, which was talking to people, and people would tell us the way it's supposed to happen. But as part of this process, it was going out and actually seeing how it happens at different hours and with different staff. And we ended up with tons of clouds. And now we're just used to it. We're going to get clouds on every single one. So those are some of the key differences that we learned during the Jumpstart engagement from the rapid improvement events. A couple others so the flow maps and the process maps and the prep work was key. We didn't typically do that, not to this extent. And I think the other thing that happened was because we had very clear roles for a sponsor, that's why I felt committed to, I've been tagged responsible for one of these, so I had to have an answer to that to support the team. We had clear roles for sponsor, we had clear roles for process owner as to who's responsible for getting all the stuff in place. Clear roles for the frontline staff who were invited to the event, and then the event is facilitated. In that environment, that allowed everybody to do their best, but the planning meetings beforehand is where all the issues surfaced, and these are usually, and I think in the past, the meetings would occur in the meeting after the meeting, but they all, because we had a structured process for, it's 3 planning meetings beforehand, and then the other thing that came out of this is typically we would have an improvement activity and then we'd all go back to work. In this way, we have this very structured month 1, month 2, month 3 follow-up. So it's a very structured process, but that's where the sustainability comes through because you work through.
I think the other key piece too was our data. So in the past, you know, quality team or whomever is collecting that data would bring the data and nobody trusted the data. And so really kind of working through that it doesn't have to be perfect. We just have to trust it enough to move forward with it. It just has to be good enough, right? We're not doing research here. So I think that was another big lesson that kind of came out of that those original rapid improvement events.
So that's all the Jumpstart engagement. So at this point, we decided we really like this and we wanted it yesterday. And so we moved into in 2024, May of last year, moved into the transformation engagement. So when we talk to our VMI partners, they are very clear. You guys even haven't hit year 1. We're almost at that year 1 marker. And again, because we want it all yesterday. I think you guys are the same. Because we're taking care of patients today, every day. So one of the big things was we had an innovation event. And part of the driving force for this was, again, our VMI consultant, we're friends now. He said he was recognizing that this was becoming the Angie and Jen show, and it doesn't work that way. And so we really needed, and he was also bothered by, he was hearing a lot of VMI. It was becoming part of our culture. We like the VMI way, we want to do this, can you VMI it? And so he kind of wanted to make sure that we put a stop to that as we kind of move forward. And so we actually had a sharp line in the sand in an innovation event focused on how do we make this our own. And so one of the activities that we're going to have you guys participate in for a few seconds, just so that you get a taste. It was and this is a different type of event, also facilitated. But we have to do prep work. And one of the prep work exercises, we had a couple exercises. One exercise was to listen to a song and then listen to a cover of that song and how it's different and how it's not different. And it's the same song, but it's different. So we're working with VMI, but we're making our own program. So the song that our group had.
Smells like Teen Spirit. I know everybody knows this one.
And this cover, a lot of people were not familiar with it, and the first time I heard it, I was like, I could not believe it's the same song. So you can see how an exercise like that can get you into the mood of, we're standardizing, but we're making it our own, and having this kind of discussions out of our healthcare zone of what do you want to keep and what do you, because it's us, that's important to us, versus what do we need from Virginia Mason. We had at the event, people from all over the organization. We had one board member. We had frontline staff members. We had one person from each of the events, because it was a jumpstart. They've not touched a lot of people, but we had a physician from our outpatient group, a physician from our inpatient group, nurses, pharmacists, etc. But only 15 people, because we can't invite the world, and that's our other challenge. Tina was there, that we learned.
I think too, very important kind of through the process, Robbie, who's our consultant, really recognized that our history is hugely important to us. And kind of those pictures on the previous screen, we went around like groups of us to different areas of the organization, what's important to us. Being the end of the road, being the Golden Heart City, how do we integrate that into kind of our feeling moving forward? So we did a lot of kind of investment in time and really kind of trying to come up with names. We worked as various groups and put it together, and we ended up coming up with the title FHP Forward, for Foundation Health Partners Forward, and really focusing on being patient-centered, empowerment, and improvement. And then we developed our visual. So we did a bunch of different variations of that. So next slide. And then this is a kind of our final draft. So the one on the left is our logo, which you can see on our slides throughout the presentation. And then the one on the right is how we actually visualize that and teach that to everybody throughout the organization.
So this is what we use. And it's become part of a lot of our meetings now. And so it's a way to center the meeting. So it's based on our 4 pillars. It has the Aurora, felt very strongly about that. That's Fairbanks. It has the community, which is very, very strong in Fairbanks. Homage was paid to the Golden Heart, because there's a little gold heart, but we didn't want the Golden Heart anywhere. But we really needed these things from Virginia Mason, and it was really around the improvement work. We needed standardized tools, we needed processes, we needed to involve our staff, and we weren't really good at doing that consistently. So that's why those principles are called out. And we wanted to give homage to our vision. And the arrow, I will just share, I got reminded in a meeting that I was sharing this with by one of our physicians who had been there, and just like she called it out, the arrow's intentionally not straight because the path is not straight. And so a lot of thought, and there's a lot of ownership, which I think is the most important thing. I'm going to go through some of the next slides quickly because we want to make sure we get the lessons learned. So we still have a lot of events. These are the events from 2024. Then we did some more than what was in the Jumpstart, but flow workshops on an ongoing basis, making that kind of standard advanced daily management. At this point in time, we're still only at roughly about 60% of our leaders have been trained. The rapid improvement events over the course of 2024 is when we learned that we had actually sustained the results. The biggest thing coming out of the CAUTI I want to call your attention to is that we actually decreased the amount of Foley time for patients by 50%, which is just, I think, much more significant than anything we could have dreamed of wanting to accomplish. Instead of all this 10% reduction, et cetera, really meaningful for patients. And then on the SPD, the fact that we've not had a surgery canceled. Again, lots of other improvements also. We got rid of blue towels that we've been using across the organization, which is a whole story in itself. But the main thing is, like I said, we've not canceled. The quality team is on a journey, and Jen's going to go through that.
Yeah, so the quality improvement team, we started out with 3 quality improvement specialists. We've now expanded to 5, but we really have gone through a lot of extra training. So we have become kind of the experts to be able to roll this out throughout the organization. One of the biggest things, the picture up there, I don't know, you may have seen it before, it's a Taiichi Ono picture, but really having those big eyes and big ears. And I would say personally, that was my biggest learning lesson throughout all of my training that I've had so far, is really just observing, listening, and watching, because you learn oh so much. It kind of feels like a waste of time in the moment, but oh my gosh, learned a ton. So lots of stuff that we are now offering that we're able to kind of teach other areas and kind of walk through other areas with them. So this is our team now. So we now have 5 quality improvement specialists. We actually went through advanced process improvement training with Virginia Mason. We had 8 people that went through this, and these are just some examples of stuff that we did. So we did some 5S, spaghetti diagrams, waste walk, time observation forms, kind of really observing and finding medians and modes and all that good stuff to improve our processes.
So this is the structure part, the tools part, which is really, really important, but it's only one component.
And then the value stream map. I think this is probably the biggest learning lesson that we kind of, for my team, that we have learned from, as Dr. Ramirez mentioned below, the clouds are huge. We try to do these value stream maps at times and we can't do them because we do not have standardized processes. So it's been a huge, huge learning process. Learned about Kanban. So a bunch of different stuff that my team now has kind of in their back pocket. We have 4 more people going through this training currently, and so they're learning as we go.
So Jen skipped over. The training is roughly 10 hours a week for about 3 months. So it's a significant investment of time. We are taking our quality team through it. Virginia Mason took a lot of their operational leaders through it. And so that's a conversation that's we'll have in the future with Nikki's help. So where are we today? So one of the things that's happening right now is the executive leadership team and the senior leadership team is going through a series of readings, because a lot of this is cultural and a lot of this is leadership. They're going through a series of readings that we discovered. I've read a white paper of Virginia Mason's work with 5 National Health Service hospitals. That work was actually much more relevant to us sometimes than the Virginia Mason story, because the Virginia Mason story is they've been doing it for 25 years. So sometimes they're speaking to us. They're wonderful, don't get me wrong, but we're very early in our journey. So the work that they did with the National Health Service is much more recent. And this was an independent review by the Wharton School of Business. And they kind of came back with some lessons learned, 2 prerequisites. They shared when they looked at all the hospitals that they worked with, where it was successful, you have to have stable leadership, which we actually do right now. We have had for the past 5 years, where you have changing leadership. It just kind of never really took off. And then the other thing is you really have to have done some values work or how to focus on values. And again, we've been very strong in that for years and years. We have that down. But this is actually one of the lessons learned. So after you take away those 2 prerequisites, they kind of broke it down into kind of number of lessons. We are working through that as a group. But one of the lessons is that relationships are critically important. So you can't do this without the relationships. And so it's relationships with physicians, it's relationships amongst the senior leadership team, it's relationships amongst with all the staff. I will share, we, as an executive leadership team, so after our trip to Seattle, we, our fearless leader, Shelley, our CEO, took us through a book called The 5 Dysfunctions of a Team, which you guys may be familiar with. We actually did some of those exercises at each chapter, which are very challenging and very emotionally, get very vulnerable. And we have these 5-hour meetings once a month on Fridays, which is why Fridays, but it's the only time everybody's available. We used to dread them, but now we don't. Now we have, it has brought us into alignment. But one of our team members was coming back from Seattle and she was reading the book to try to get prepared. And she was sitting on the plane from Seattle to Fairbanks and reading the book, and the person next to her wanted to know what book she was reading, and she said the name of the book and explained what we were doing, and then he wanted to know where she worked. So she chose not to disclose that because I didn't want to embarrass us that we're so dysfunctional. But again, the emphasis was that this is just as much, if not more, about culture as it is about the tools. So again, some of the challenges that we have found is we have hired leaders, we have grown up as leaders in our organization as the people who get it done. That's the superhero leader. And really changing over to being leaders as problem framers instead of problem solvers is something that's not easy for us. But it is the only way to engage all of our staff and get to sustainable solutions. And it's not just the point of engaging so that we have sustainability and making our staff happy, which I really want though. It's also that there is way too much work for all of us to get done in healthcare. No leadership group has the bandwidth to solve all the problems. And by the way, we're a little bit more removed from the work. We need the people who are closer to the work who actually know what's happening, but it needs to be done in a structured way, in a facilitated way so that we can move forward. Virginia Mason has really truly developed that in a very effective way over many years. But those are some of our challenges. Another challenge is that variable adoption. We haven't finished training everybody. Some people have just grasped it and they're off to the races. Other areas, not quite sure what to do with it. And so how do we support them? And then prioritization, we struggle with competing priorities and too much to do, like everybody does. So we're really working this year on really trying to transition. Our commitment is that this is not just an improvement system, but that this is a management system. So it's how we manage IT. Is how we lead the whole organization. And that's our commitment. And so really breaking down silos, we have projects around those things. This is a slide that I have to give credit to Shelley, myself, Jen, and Robbie. So Shelley asked me, we have a 5-year vision, that integrated healthcare system. And on the quality end, the goal is to become 5 stars and leapfrog A. And so we've done a lot of work last year. We are moving from 2 stars to 3 stars in April. We're very happy with that. But she wants to know, is this really realistic for us to be 5 stars 5 years from now? I said, yes. But it dawned on me, I know it's realistic because we have a plan and we have a game plan and, but it's all been in my head and in Jen's head, and we're working on it. So this is our attempt at visual management of how we're going to achieve our 5-year goal and leapfrog, the CMS star rating, that growing FHP forward logo as that gets stronger. That's our methodology. But our board loved it because kind of like, we don't live this every day. Thank you for having something. So again, the visual management is something that we're all learning how we can use it better as a tool in everything we do. For the providers, I passed out at your tables. I will need the cards back because that is the last printing ever known because Jack, he came out of retirement. So when I called Jack, he answered the phone and I found his website and it was old and dated. And I thought he'd gone out of business. And when I called the phone, he answered hello. And I was, oh my God, he is out of business. But he said he was Jack Silverstein. And then he told me that you COVID kind of put me out of business. I don't do this anymore. I don't have time to talk to you now. Why don't you tell me what you really want and I'll see if I want to schedule time with you. Oh my God. So I convinced them enough, we scheduled time and we've had this wonderful relationship and friendship ever since. But the Trust Busters, there's not going to be another printing. We need those cards back. On the compact work, the colored one, can I have the colored one? Hold up. This is our compact now with our clinic employed docs. It is alive and well. They use it whenever they recruit a new doc. We've had docs choose us because we want to work at a place that actually, and they told us that, a place that actually cares about this and values us enough to do this kind of work and can actually commit to these things. And then they've also used it, the docs have used it to have crucial conversations. And they find this a lot easier than the code of conduct that they had nothing to do with. This they own because they helped create it. So it is driving care. The other one is, because we did it in 2 groups, because that's who we were. This one is still a work in progress. And this is for our whole medical staff, the hospital medical staff, but it will encompass all of our clinic employed docs as well. And so you can see, there's been a lot of growth and evolution, and this is much more nuanced than where we started with, we need to be respectful of each other and build trust. So that's where the physicians are, and they love the, it's about time. It's kind of their perspective on the Virginia Mason work.
So kind of overarching lessons learned. I love the graphic up on the left there. Robbie, our consultant, kind of points us to this all the time. So we're kind of in 2 places, right? We're on the dock, what we know, and then we're on this boat that we want to sail forward. And so sometimes you just want to go back to what you know. So kind of keeping that change and kind of pushing it, because change is hard. Changing culture is even harder. And it's not fast, it's slow, but you got to keep at it. Being data driven is huge for us. People like to say, oh yeah, we fixed that, and then they don't have the data to prove it. So we have a history of doing, rather than PDSA, we do PDA. And so we have a habit of missing that study piece to really, before we act. This is just some of the results of the improving flow workshops. We put together pelvic kits in the first care setting and in the family practice setting. That way the docs have everything they need when they have to do a pelvic. And it gives pictures on how to set up the tray, the sterile tray for the doc. So it's done the same way every time.
I will just throw in, so standardizing had always been hard with clinic procedures. You kind of trial it, and then you roll it out. So the Virginia Mason ways, you try it, 1 person, 1 doc, then you try it with 2 docs, but you're committed to kind of adapt it. And then you do 4 docs, and then you do 8 docs. You don't just go. And they didn't believe it, and then they did it that way. And Jen said, we did this. I would just emphasize they did it.
Yeah.
We supported them with the tools, we supported them those ways, but they made the decisions, they had the conversations, they own it. This is now how they use all their team meetings, is on improvement activities.
So I'm not going to go over this slide, but this is just a bunch of the stuff that we were able to accomplish last year. Various people throughout the organization that were involved in different things. And then I think the big thing is just, I don't know if you see there, improving flow workshops that included 83 providers. That includes docs, PAs, nurse practitioners, nursing staff, MAs. They have really taken these flow workshops and embraced them. We also put out a survey to our leadership and to the people who were involved in quality improvement last year. And so this is kind of where we're at. What I do want to kind of, really push is we only had 46 people respond, but a lot of those, 26 of them, have standardized processes, which is huge because we didn't have standardized processes. So, that's huge. 78 of the people have implemented some form of visual display or started huddling or have implemented PDSAs with their staff. And then I wanted to kind of go over this, so everybody's kind of seen Roger's diffusion of innovation. I saw this graphic and I loved it. I really feel like we're at that tipping point, at kind of that 16% there, where we're just about to really kind of make that big swing to making this real. And then these are kind of events that we already have done or have planned for this year. Really getting buy-in from various leaders, people who haven't been involved but have heard. The one that I'm really excited about is pharmacy. We're going to be bringing a group together to do a rapid improvement event on med reconciliation. So I'm really excited for that one. Any questions, comments?
Yeah,